So welcome back. Today we will be talking about diabetes, which simply means that the blood glucose is too high or the sugar in the blood is too high. It actually is one of the oldest human diseases that was recorded by the Egyptians in 1500 BC, and it's given its name by the Greeks in about 200 BC. Diabetes means to pass through because they would see these patients who would drink lots of water and then just turn around and pee it out. And the reason the body was doing this, it was trying to get rid of the extra sugar. And the reason that's very important in the body, is, as we know, is that there are enzymes that need that specific level of everything to even work. And enzymes are everywhere. They're in the smallest part of the body, the cell. They're in the tissues like the muscle. They're in the structures like the bone. They're in the organs like the heart, etc. They're even in the small arteries that connect this whole system. And so when the sugar gets too high in the blood, a couple of things happen. One of the things that happens is that the kidneys start to urinate more glucose out. The second thing that happens is that they signal a hormone called insulin to the smallest part of the body, the cells, and says, hey, you need to absorb some of this glucose from the blood so that it doesn't ruin the party for everyone. Now the cells can do it up until a point, but then after a while, the situation becomes more like, you don't have to go home, but you can't stay here type of thing. And so at that point, the body then starts dumping this extra sugar anywhere it can. And the easiest place to deposit glucose in the body is to put it in small arteries and then the tissues around them. So the ones that go to the brain, the back of the eye, the heart, the kidney, the nerves, which is why diabetics will get more strokes, more diabetic retinopathy, which is damage to the back of the eye, more heart attacks, more kidney disease, and more neuropathy, which is damage to the nerves itself. Now, it is well documented that if you can control the sugar early on, you can avoid all of these complications. So sometimes it's better as a patient, finds the forest and is able to exercise or diet or lose weight, if they start a medication early on so that the sugars are more normal to prevent this long-term damage. Now remember, any medicine can be stopped at any time, it can be adjusted, it can be changed, so don't be afraid of starting medications in general, because as Armin Adlert said, when people are faced with a situation they don't understand, it's easy for fear to take hold. Until next time.